Okay, so we are announcing today that the current public health order is expiring today, right? But effective tomorrow, we have a new public health order, and I've alerted folks that it's extended through May 15th, and that the magic about that is it gives us full 2 weeks to see what's occurring, to make sure that we're bringing to you our modeling and the data, and that we can make the next set of decisions based on that scientific evidence. Because what's the goal? Everything we do has to keep New Mexicans safe. And so where are we? So what's different then if I'm keeping a public health order? What's different? Well, we're now in a preparation phase. So here's what's changing. So non-essential retailers can open up. They can do that by having curbside pickup and delivery service where permitted by their license. Well, what does that mean? Not every retailer, as an example, liquor stores, their license, their statutory oversight in the state doesn't allow that. There isn't anything I can do to change that statute. Most retailers don't have those restrictions, so now they're allowed to open their businesses and provide those services to New Mexicans. State parks, I'm clear, we're all clear. Self-isolation and isolating is very hard, and with this incredible, beautiful New Mexico weather, the fact that people can't take a day trip to a state park to just engage in any outdoor activity and the beauty of the state, we want to make sure that we're providing this. Now, I want to point out that camping and visitor centers are still closed. We will provide this in a separate press release and will be on the website. Not every state park can open all at once, although they're allowed to effective tomorrow. We do have to staff up and make sure we do all the work to make them as safe as possible by doing the right kind of signage for social distancing and cleaning, and we will do that. Pet services. So we know that adoption and groomers and doggy, maybe there's kitty daycare too, and boarding, that's been a real stress on families and pets. We want to make sure that those services are now permitted to operate. Again, we're going to talk about the standards for that and how you can make those as safe as possible for the public. Veterinarians always could operate in an emergency service, and people might wonder why we didn't just open it up again. You want to manage the virus, coexist, but protect people. No unnecessary travel, trips, or businesses. That did include veterinarians. Starting tomorrow, veterinarians are permitted to operate. Golf courses. Now, I want to be really clear that where we had no state authority, there were some tribal golf courses that have been operating. I know that that's caused confusion and maybe even in your community some consternation. My job again is to do the best possible job in the state with the authority that I have to protect people and slow the spread of the virus. So this was an area we just didn't want people traveling to. The Economic Recovery Council and I've adopted and accepted that recommendation. Golf courses are allowed now to open statewide, but for golf only, no dine-in, food service, or retail. And I said statewide, we have a state plan, but if the state plan can't be met by the entire state, you will hear that later in my remarks and in this press conference, we have a region of the state that is not at a transmission phase that meets any of the gating, the federal requirements or the state requirements to meet this new public health order. So I want to be clear about that. Gun stores can now operate by appointment only. And the reason for that is too many New Mexicans need to be able to finalize their gun purchases for background checks. We recognize that, and we think this meets the same non-essential retailers criteria. They can't do curbside, but they are permitted to do by appointment only. So that changes tomorrow. Next slide. All right, so what remains closed with this instruction? Well, we still want you to stay at home. I know that sounds like we give that message too often, but I drove to the Capitol today. I mentioned that I often do deliveries in Albuquerque to my family on the doorstep, and I go see my mother via a window, right? A wave. I can see, everyone can see, there's national aggregate data that shows you where people are traveling. People are traveling. A virus needs you to travel to transmit. You catch it, you give it. We don't want you to do that. We're staying the instruction to remain in place, except for these essential services. All right. What else remains closed? Offices, workspaces, and retailers, except for the exceptions. If you can't do curbside or delivery, and it's not an appointment-only exception, they're still closed. Dine-in restaurants and bars, except for curbside delivery, are also still closed. I'll tell you what we believe based on the contact and the time you spend there, which Dr. Scrakes is going to talk about. We made these decisions not based on the business, but based on the safety of the public and the safety of the employees there. We'll show you how we did that using an evidence-based model. Here's what's still unsafe and closed. Indoor malls, gyms, salons, theaters, and casinos. Mass gatherings, still prohibited. And the 14-day quarantine order remains in place for all out-of-state airport arrivals. All right, next slide. So how do we then move to the next phase? All right, well, we're going to continue to use the modeling by the medical advisory team, so you're going to hear more about that. But we analyze the spread of the virus. Where is it? How quickly is it spreading? What are those rates and ratios? And that's how we'll keep making decisions. So can you help? You bet you can. The more you restrict, even with opening, and we do want to ease the relaxing of these restrictions, we hope is good for business. We hope it's good for individuals too. We have to marry these safe personal practices, or we'll see a spike that's not anticipated, and that's when you're not prepared. Emergency preparedness means knowing what's going to happen. We are going to see more cases. Even without relaxing restrictions, we're still in that phase where we're going to see increased cases. We want to keep them below a certain percentage. We see how they're transmitting, what that rate is, where it is. As long as that curve statewide still is flattened, then we think that we can make these decisions safely, which is why we are. We have to continue having adequate and stable testing, and that's measured by the Department of Health. Quite frankly, we have a lot of partners doing testing now, actual testing and running the tests. But the Department of Health is leading that effort. It's an incredible undertaking, and they will have to continue to do that. Effective contact tracing plans and resources. That's going to be measured also by the Department of Health, and they have a very specific division, population health experts, doctors, and scientists. That's the epidemiology division. That division has to have, they will tell us that they believe that we can do sufficient contact tracing. And I know that that sounds easy. I have COVID-19. I was identified as positive. Here's the family members I was around. I'm not working. And I went to this grocery store. I didn't touch anyone. We're done. No. You have to really think about if anybody else in the household, if you went for a walk, if you were in a car with someone else, what grocery store, where in that area, how close did you get to it? We have to do all of that work. And while we're moving to that digitizing phase of this work, it is still a lot of personal contact. So it's incredibly time intensive. And for places in New Mexico without broadband and telephones, it is even more challenging for a rural, vulnerable minority population. So it's a huge undertaking, but we are well on our way. And the healthcare system capacity and personal protection equipment levels, that's also measured by the Department of Health and by the medical advisory team. I keep pointing to my two experts and leads. That will be analyzed all of the time. And if that doesn't stay stable, what does that mean? That the healthcare system can take it, that we have enough equipment and support, then we can't go to the next phase. So we'll have a phase 1, more relaxing, phase 2, more businesses, more economic recovery. Phase 3 means we're closing in on a vaccine and we feel like it's completely back to normal with this. Everyone on the globe has learned the lesson about a pandemic. They can strike again, likely will, and we just have to start thinking about our own behaviors that will allow us to be as prepared as possible and to have our behaviors dictate the kind of responses that save as many lives as possible.